Welcome to our YouTube channel. This is Cry Aloud Messengers and I'm your host, Sister Edith Zombe. Today on our study, we want to talk about prescription drugs and medication from doctors and physicians. We want to know, brothers and sisters, that these drugs and medication that we take from the doctors, from the clinics, that we buy from the pharmacies, do they really heal us? Do they really treat the maladies? We read from Counsels for the Church, page 105. It reads, "Drug medication, as it is generally practiced, is a curse. Educate away from drugs. Use them less and less and depend more upon hygienic agencies. Then nature will respond to God's physicians. Pure air, pure water, proper exercise, a clear conscience. Those who persist in the use of tea, coffee, and flesh meats will feel the need of drugs. But many might recover without 1 grain of medicine if they would obey the laws of health. Drugs need seldom be used." Here, brothers and sisters, we are being told that drug medication is a curse, and we as the children of God, we must educate away from drugs, and we must follow and obey the laws of health. Here is the video that we are going to watch. This video is telling us that drugs are the third leading cause of death.
My name is Peter Gurtje. I'm a director of the Nordic Cochrane Center in Copenhagen and professor of research design and analysis at the University of Copenhagen. 2 years ago, I found out that our prescription drugs are the third leading cause of death after heart disease and cancer. Our drugs kill around 200,000 people in America every year, and half of these people die while they do what their doctors told them. So they die because of the side effects. The other half die because of errors. And it's often the doctors that make the errors, because any drug may come with 20, 30 or 40 warnings, contraindications, precautions and so on. No doctor in the world knows about all this. So they give patients drugs that they should not have given them, that interact dangerously with other drugs or food items or so on. And then the patients die. That's the other half. So the other thing I found out 2 years ago was that much of what the drug industry does fulfills the criteria for organized crime in US law. And they behave in many ways like the mafia does. They corrupt everyone they can corrupt. They have bought every type of person, even including ministers of health in some countries. So there is a huge amount of corruption. In my country, for example, Denmark, we are regarded as having very little corruption. But yet we have thousands of doctors on industry payroll, although we are just 20,000 doctors. So this is an effective kind of corruption. The drug industry buys the professors first, then chiefs of department, then other chief physicians and so on. They don't buy junior doctors. So when several thousands are on industry payroll, it's really, really bad. And that's why I wrote my book, Deadly Medicines and Organized Crime, How Big Pharma Has Corrupted Healthcare. I hope to convince patients not to take so many drugs, because so many die from the drugs they take. In my country, people take so many drugs that every single citizen can be in treatment with 1.5 drugs from they are born till they die. This is incredible. And drugs are not that helpful. And they kill very many of us. We know that. That's why drugs are the third major killer after heart disease and cancer. So what we need in the coming years is to take far fewer drugs than what we do currently. If we did that and we were careful, then we could live longer and live better lives, because drugs have many side effects, and patients often don't realize that when they become worse, that it could be a side effect of the drug, which they continue taking because that's what their doctors tell them. So when I was a specialist in internal medicine, what I very often did was that I stopped a lot of drugs, particularly in elderly people, and it's quite revealing to see a bedridden elderly person come into your ward, and when you stop the drugs, I mean, that person becomes many years younger. And many of these drugs affect the brain, and old people tolerate that very, very badly. They fall, and when they break a hip, a quarter of them die. And for example, antidepressant drugs are used in more than 10% of our elderly. And they seem to kill 3% of them every year. I mean, if 100 old people take an antidepressant for 1 year, 3% of them will die because they fall and break their hip. This is a huge death rate. So a lot of other drugs than antidepressants also make people fall and kill them. And they may affect your cognition, your memory, and all these things. And then they interact in ways that we know almost nothing about. Very many elderly, they take more than 5 drugs a day. And we actually don't know how these drugs interact with each other. What we do know is that all drugs have many effects in the body, and some of them interact also in their metabolism, so that you can get a too high concentration of a drug if you take other drugs simultaneously. So we make a lot of harms that we don't even recognize. I have a pretty colorful collection of things people have called me during all these years. And sometimes journalists have asked me, why do you always look up controversy? And my reply is, I don't. Controversy looks me up. Because it's not popular to tell the truth in healthcare. You will get a lot of enemies. Because a lot of people make money on false premises. Doctors and industry alike. And our drug regulators and our politicians, they are on board on this wagon. So very few people are independent of money in healthcare. And of course...
So here, brothers and sisters, we heard that many people, they die because of the drugs that they take. It is said that these people, they die even if they take these drugs prescribed by the physicians and the doctors. It is because of the side effects of these poisonous drugs. Use of poisonous drugs. We read from Counsels for the Church, page 105. It reads, a practice that is laying the foundation of a vast amount of disease and of even more serious evils is the free use of poisonous drugs. When attacked by disease, many will not take the trouble to search out the cause of their illness. Their chief anxiety is to rid themselves of pain and inconvenience. By the use of poisonous drugs, many bring upon themselves lifelong illness, and many lives are lost that might be saved by the use of natural remedies. By the use of natural methods of healing. The poisons contained in many so-called remedies create habits and appetites that mean ruin to both soul and body. Here, brothers and sisters, the quotation is telling us that a practice that is laying the foundation of vast amount of disease and of more serious evils is the free use of poisonous drugs. These drugs that we take from the doctors, that we buy from the pharmacies, are the ones that are causing illness. And the quotation is telling us that many people die not because of the disease, but they die because of the drugs, of which their lives were going to be saved only if they used natural methods of healing. Avoid the use of drugs. We read from Testimonies for the Church, Volume 5, page 113, 1885. You should avoid the use of drugs and carefully preserve the laws of health, but drugging should be forever abandoned. For while it does not cure any malady, it enfeebles the system, making it more susceptible to disease. Here, brothers and sisters, we are being told that we must avoid the use of drugs. Whenever we get sick, drugs must not be taken. We must use the natural ways of healing. Hence, drugging should be forever abandoned. And we see that if we take these drugs hoping that they will cure the disease, they do not, brothers and sisters. But what they do, they enfeeble our system, making our bodies to be more susceptible to diseases, meaning that our bodies can be attacked by any disease at any other time. Drugs do not cure disease. We read from Counsels for the Church, page 89. It reads, people need to be taught that drugs do not cure disease. It is true that they sometimes afford present relief, and the patient appears to recover as the result of their use. This is because nature has sufficient vital force to expel the poison and to correct the conditions that caused the disease. Health is recovered in spite of drug, but in most cases the drug only changes the form and location of the disease. Often the effect of the poison seems to be overcome for a time, but the results remain in the system and work great harm at some later period. Here, brothers and sisters, as we have already said, that these drugs, they have so many side effects that they cause death. Here we are being told that it is true, yes, that sometimes these drugs can afford present relief, and then the patient appears to recover as a result of their use. But that does not mean that the disease is cured. But in most cases, brothers and sisters, what do these drugs do? They change the form and location of disease. That is that you find that when times go on, this disease will reappear in another form. For instance, when you take these medicines, for instance, for ulcers, with time you'll find yourself having cancer. Reappear in a new form. We read from How to Live, page 61. It reads, the disease which the drug was given to cure may disappear, but only to reappear in a new form, such as skin disease, ulcers, painful diseased joints, and sometimes in a more dangerous and deadly form. The liver, heart, and brain are frequently affected by drugs, and often all these organs are burdened with disease. These organs, which should be in healthy condition, are enfeebled and the blood becomes impure. We also read from How to Live, page 57. It reads, the drugs given to stupefy whatever they may be derange the nervous system. As we already said, brothers and sisters, that these drugs that we take, they change the form and the location of the disease. Here the quotation tells us that it will come back, it will reappear in a form of skin disease, ulcers, painful joints, and even more dangerous and deadly diseases. You'll find that someone is suffering from liver, heart failure, liver problems, and even brain tumor. God-fearing medical missionaries. We read from manuscript Manuscript 50, 1909. It reads, institutions for the care of the sick are to be established, where those who are suffering from disease may be placed under the care of God-fearing medical missionaries and be treated without drugs. Here, brothers and sisters, we see that these God-fearing medical missionaries, they treat people without the use of drugs. They use natural remedies. They use herbs. We also read Manuscript 49, 1908. It reads, in our sanitariums, we advocate the use of simple remedies. We discourage the use of drugs, for they poison the current of the blood. In these institutions, sensible instruction should be given how to eat, how to drink, how to dress, and how to live, so that the health may be preserved. Here, brothers and sisters, we see that these natural remedies are being used to treat the sick people. And we also see that people are being taught on how to dress, how to eat, and how to live healthy. We see, brothers and sisters, that the way we eat, the way we drink, the way we eat, the way we dress, all these things, they contribute to our healthy living. Take heed. We read from Psalms 139 verse 14. It reads, I will praise thee, for I am fearfully and wonderfully made. Marvelous are thy works, and that my soul knoweth right well. We also read Psalms 104 verse 14. It reads, he causeth the grass to grow for the cattle, and herb for the service of men, that he may bring forth food out of the earth. We also read Genesis 1 verse 29. It reads, and God said, behold, I have given you every herb-bearing seed, which is upon the face of the earth, and every tree in the which is the fruit of a tree yielding seed. To you it shall be for meat. And also Jeremiah 8 verse 22. Is there no balm in Gilead? Is there no physician there? Why then is not the health of the daughter of my people recovered? Here, brothers and sisters, we know that indeed we are fearfully and wonderfully made. These verses are telling us that God caused the grass to grow for the cattle and herb for the service of men. Here, brothers and sisters, we see that these bodies that God has given us, we must love these bodies and we must take care of them. We must know what to eat, what to put in these bodies so that they can function properly. Conclusion of the matter. Drug medication, as it is generally practiced, is a curse. Educate away from drugs. By the use of poisonous drugs, many bring upon themselves lifelong illness, and many lives are lost that might be saved by the use of natural methods of healing. The disease which the drug was given to cure may disappear, but only to reappear in a new form. For more information, contact our admins at Cry Aloud Messengers. You can also send us an email if you want me to send you this book called The Entering Wedge. This book has more information about what we were talking about today. So, brothers and sisters, we must be very careful on what we eat. We must make food our medicine. God bless.